Facebow is one of the most technique-sensitive tools that you can use in your practice. It's also one of the most important records to utilize and for patient communication with your lab. It's absolutely important and communicates smiles, cants, extremely important in all your cosmetic cases, and absolutely important in all your functional rehabs. Let me talk to you a little bit about what comes in your AD2 Facebow kit, which is the Facebow we recommend for the Clinical Mastery series. The first thing is the Facebow plate. This is actually what the record is going to be that goes off to the lab. It's important to snap it in place onto the 4 prongs that are there. You want to make sure that there's no space in the posterior aspect because that's going to create a problem. It's going to be an inaccurate record. It has to match up perfectly in place, which is why you want to use the AD2 plates with the AD2 Facebow. Next thing, there are 2 components that come into the Facebow kit. You have a level and you have a laser point. Now, I don't use the leveler in my practice. Here's why. You can use this when you're positioning your patient's head level to the horizon. But you can see in this operatory, it's pretty difficult to have a landmark that you can place your patient up against and verify that he or she are holding their head level to the horizon. That's where this bubbler works really well to know that you're level to the floor. But if the patient has their head tilted, this level isn't going to transfer our Facebow record properly. That's why I like to use the laser. The laser just transfers a vertical and a horizontal line onto our patient's face so that we can verify that that horizontal line is parallel with their interpupillary line. We can also verify that the vertical record is basically dividing their face in half. All you have to do is snap it right into place on the magnets. So let's see how to use the Facebow in action. So just a couple quick tips on how I position my patient for the Facebow. So, I've heard it numerous times about using the horizon in order to parallel the Facebow to. That works really well if you have something in your operatory that you know is level, like you have a wall with glass block, something that you know that you can position your patient up against as a background, and then you can line up their interpupillary line with that parallel position. The problem is many offices are like this, where we don't have a background that offers us that. And many times patients will sit with a head tilt or something similar where their head is not parallel to the horizon. So I don't like to use the horizon as the landmark. I like to use the patient's interpupillary line, which is how this Facebow is designed to work. So I'm gonna first put the Facebow in and just put it up against Luke's teeth to see what we're dealing with here. Open for me. So what's really important is you want to make sure that the vertical aspect of the anterior portion of the Facebow plate is right up against the central incisors. It doesn't have to touch the horizontal portion of the plate, but it has to touch the vertical portion of the plate. Because if the patient has a reverse smile, the centrals will be off the plate. But you want that vertical portion to be against the centrals. That's what's required when using this Facebow, because this Facebow works off of a length of about 110 millimeters on average from the condylar access to the central incisors. So that's what we're gonna do here. So I'm gonna line it up, put it on his centrals, put it on the midline, and then I'm going to see what we're dealing with. So if I look, he has got a little bit of a cant. We can see that the laser is not parallel to his interpupillary line. So what I have to do is line it up so that horizontal portion of the laser is parallel to his interpupillary line. So now what we're going to do, when I put bite registration material in, I know that I can't keep it flat up against his teeth because the Facebow is canted. I have to turn it, and I'm gonna have more registration material on one side than I am the other. So I always practice it first. I'm gonna put some extra material where I know I have to create that space. Now I just have to hold it there. What you notice on many patients is their nose is a little bit one side to the other. So don't use their nose as a landmark. Use the glabella, which is the portion right in between their eyebrows. Okay, once the material's set, now what I'm going to do, it's really important to take a picture of this as verification for the lab. The lab wants to see a photo so they can see exactly what it looks like in Luke's mouth. Luke, do me a favor. Take your thumbs on the inside, hold up on the plate here. Good, open your hands up for me. Now, don't let not having a great camera be your excuse for doing this. As a matter of fact, because of the laser, your cell phone works great here. So all I'm gonna do is open up my cell phone. Luke, look towards me. Make sure I can see the laser and see his face. Pop that picture, and it's off to the lab, and you have now done a perfect Facebow. So let me show you what the lab does with the Facebow record, so then you can clearly understand how important what you're doing in the patient's mouth is. So the first part is, how do you get the plate off of the Facebow? You don't want to sit here and try to wedge it or bang it. You don't want to bend your Facebow plate. All I do is I sit here and I push on the prongs underneath with my finger, and it pulls right out. This is the only part that's going to your lab, which is why we recommend this. These plates cost $1, $1.25 a piece. So much more economical than a $350 or $500 earbow jig. When you're doing lots of records in a week, it can become quite expensive having all of those earbow jigs going off to the lab, and keeping track of them can become a quite tedious process. So the Facebow plate comes to the lab. What the lab's going to do with it, they have a Stratus 300 articulator, and they have a mounting table here. So the mounting table has the exact same 4-prong receivers that are on the opposite side of your Facebow jig. So this is going to snap in place. Now what I'm going to do is, what the lab's going to do is take your maxillary model of your patient and fit it into the bite registrations that are here. Now, typically, this is already a mounted model, but typically they have a base here. They're going to put plaster. They're going to put a magnetic ring here, and then they're going to close down the articulator so that that ring fits in and the maxillary model then gets mounted. Once the plaster is set, they can take off the Facebow record, and what they can see is now the mounting table is parallel to the horizon or the floor. It's level. And now, once they close this down, they can see the exact cant that your patient has clinically, which is why it's so important to take this record properly. So when I'm looking at it, we can see this patient has a reverse smile. There's a slight cant present. The lab is now working basically on your patient. So you can understand, if you weren't able to translate this cant to the lab, when your wax up comes back, it's not going to be correct in your patient's mouth. And now it can have a cant in your final restorations or in your wax up. So this is an ideal way for you to get a perfect result back from the lab, and the two of you are working hand in hand with one another. Hopefully this clears up how you use the AD2 Facebow record.